Have you heard? Apparently, Midjourney, that company that used to generate AI images, is going into medical imaging technology. They just shared that they have developed a new system that would revolutionize the way we can image the body. And they are comparing it to MRI, but are claiming that this type of scanner can acquire full body images in about 60 seconds, and this would make it much more accessible than MRI. Well, let's look at their video and see what they have to share with us. We're already getting a view of the internal workings of the system with a lot of tubes and electricity lines. But here you can see that they choose a very different system where there's a platform where the user can stand on, and then that platform will drop. And by dropping that platform slowly, the user is being submerged by water, and then the body is basically entered into the bore of the scanner, and the scanner is surrounded by a lot of tiny ultrasound sources that surround the entire ring of that scanner. And those transmitters give off ultrasound. Some of the sound waves are reflected back, and a computed tomography image is generated from that data. And then here you can see it. The scan is finished, and the user can come out of the water immersed scanner, and that's it. They also shared a more technical video. Doesn't really explain the process, but it's worth checking out. So here they are showing how all of these mini ultrasound speakers are vibrating, giving off ultrasound. And it's not one transducer, but there are probably millions. Tiny transducers. So 8,906 transducers arranged in one grid, and then there are multiple grids. Looks nice, looks advanced, high-tech. So this is basically one element of a transducer consisting of all of these mini transducers that give off the sound waves, and they're arranged in a ring, just like in another scanner system. You can see it just looks like they have multiple ultrasound transmitters being arranged in a ring, and the body is submerged in water, which is necessary. I'll come back to that. And because they are looking at the human body from all of these angles, they can reconstruct images in all of those planes, creating a basic slice of the human body. And because the human in this scanner is dropping, it's going through the bore of that scanner, and then you can reconstruct all of those slices to create a 3D volume of the scan. And this is basically also how a CT scan or an MRI scan works. But there are some fundamental differences. And the most important thing here to realize is that it's using ultrasound. This is not an MRI system and not a CT system. And ultrasound is great for some things, but really, really poor for others. So it's great to evaluate, for example, soft tissue architecture that is relatively superficial in the human body. So, for example, looking at veins and arteries and muscles, and if you use different transducers, you can also look into the abdomen. But we're not really using it that much to analyze lung parenchyma. If we know someone has a disease, for example, bleeding in the lung or pneumothorax or a lung tumor, you can sometimes see it on ultrasound. So it is being used by pulmonologists. But CT is far superior over depicting the lung parenchyma. Both lung and bone are the enemy of ultrasound. And this has to do with these tissues either reflecting none or all of the ultrasound waves. And ultrasound images are generated based on the principle that there's a difference in reflection between two tissue types, but you always need some reflection in order to generate the image, because the transducer is basically looking at what's the difference between the ultrasound being emitted towards the body and what is coming back. Here you can imagine that if you use ultrasound, you're not going to be able to visualize the lungs, for example. But in the abdomen, there's a problem as well, because bowel contains air, and that already is quite the challenge if you want to evaluate, for example, the appendix in an individual. It can sometimes be hard if the appendix is posterior to the cecum, so that's the proximal part of the colon, which can be filled with air, and then it's just sometimes not visible to depict some of those structures. And the bowel is also moving because of peristalsis, how to pronounce that in English. So that's a long way of saying that I don't think that ultrasound is the best way to image the entire body. And obviously there are parts that you can't image with ultrasound, for example, the brain, because it's contained in the skull, and the ultrasound can penetrate that thick layer of bone. And I also see some challenges in depicting the mediastinum, so the heart and the large vessel, and the lungs, so basically the chest cavity. Breasts, you can actually image very well with ultrasound. And in the abdomen, just look at these images. These black and white images is what they claim similar to what they are going to see with this type of scanner. And it's really poor. It's really hard to depict the anatomy. Well, there's these nice color overlays, probably from some kind of AI segmentation. And there's a funny detail here, because you see that the liver here is depicted on the left side, but obviously the liver is on the right side of the human body. And so what they've done is they failed to flip the images, or they acquired the scan in a non-conventional direction. So with a CT scanner, we look from the feet towards the head. So a radiologist always has to flip left and right in his mind, because he's looking from the feet towards the head. And then normally the liver is depicted on the right side and the heart is depicted on the left side. And here it's flipped, which tells me that probably no radiologists have reviewed these images before publication. A lot of structures are being highlighted. And of course, if this is the image quality, you can actually see some kind of thing that can be valuable. And this brings me to another point where I have to say that I am stoked about this development. I'm really curious how they are going to position this, and whether it lives up to the already introduced hype. And I can actually see this working very well for body composition analysis, because here the most important markers are that of muscle volume, which is located superficially, and the amount of fat inside the muscle, the intramuscular adipose tissue, and two types of fat: visceral fat, which is inside the abdominal cavity, but mostly in the omentum and the mesentery, which should be visible, and subcutaneous fat, which obviously is just underneath the skin. So you should be able to see that as well. And with those 4 things, you can already say a lot about the status of metabolic health. And of course, there are other ways to do this. I mean, we can do total body MRI if you already acquire a CT scan in the hospital, for example, for a totally other indication. Then you can do body composition analysis on that. But you can also do DEXA scan, which has advantages and disadvantages. That is definitely one purpose that I can see this working in. And it might even be that they're not going to show the images to the individual clients. Maybe they will just calculate based on the images and then feed back, for example, the percentage of body fat and the relative muscle mass and visceral fat mass. Just think of going to the airport security, where you also have to stand inside a body scanner. No body images are displayed as a result to those who evaluate it. They just get the flag of, hey, there's something here, just check this area. And they could choose a path where they work in that way, and that has the benefit that the images don't have to look great. They just have to be analyzable for the imaging system, or probably some kind of AI system. And that brings me to another point, that I'm really curious to learn whether a radiologist is being involved, or whether this is going to be some kind of commodity in the wellness industry. I hope not. I think there's a lot of important incidental findings also in these types of images that should be reviewed by an expert, for example, a radiologist. But so really, really interesting development. I didn't see this coming, really didn't. But there's some nuance to all of the claims that are being made and the hype that's being introduced. And it mostly has to do with some basic physics constraints. But they did their best to overcome some of those, because I promised you to come back on why the body is being submerged in water. But think of why we use ultrasound gel when doing a sonographic examination, because you don't want any air between the ultrasound transducer and the skin. That will ruin your images. So we need another tissue layer in between, and for that we use the gel. But you can replace it with water. During a general ultrasound examination, if you put some water on it, will leak away. But if you submerge someone in water, this can actually work. And by doing this computed tomography technique that reconstructs it from multiple angles, you might be able to correct for some of the image disturbances created with air and bone. But I'm curious to see where this goes. Okay, I hope this was helpful. You probably saw the news, and you might have been really, really stoked about this. I hope you're still stoked, but you've got some deeper understanding of how this type of thing could work.